Hi, I'm David Brown. I'm an interventional cardiologist at the Heart Hospital Baylor Plano. We have an event related to hypertension to educate the public coming up on the 15th of November that we'd like you to attend. This is a very informal but very educational event to address the issue of uncontrolled hypertension in this country. It's a major problem right now, and we believe that we live on the cutting edge of finding and diagnosing hypertension, of treating it, and of looking at innovative research aspects of fixing this disease. So we'd very much like you to consider coming to a seminar on the 15th of November at the Heart Hospital that we believe you will find highly educational and very helpful to you and anyone with hypertension. Scott?
I'm Scott Biederman. I'm a nephrologist specializing in kidney disease and hypertension. We are looking forward to this event. We're going to talk a lot about hypertension, evaluation of the causes of hypertension, the treatment, and some of our innovations that we're working on right now. Hypertension is an epidemic in the United States. It's estimated that more than 30% of Americans are hypertensive and less than 50% of them are controlled. Hypertension is a significant increased risk for cardiovascular disease. One study suggests that for every 20 points systolic and 10 points diastolic, above 115 over 75, your cardiovascular risk doubles. So I think it's an issue that really needs to be managed a lot better than we're doing, and we are working on some innovative ways to do that.
Once you have hypertension, it needs to be treated. Many of you may remember the commercials that showed hypertension being the silent killer. You don't always have symptoms from it, but once you find it, it needs to be controlled by the lifestyle modifications that we touched on. But if it can't be, the frontline treatment for it has been medication, starting with diuretics or water pills and a whole host of classes of drugs that certainly have side effects and have been the mainstay of treatment for this for now 100 years. There are also some innovative technologies that we're very excited about and investigating at the Heart Hospital that we'll tell you about at the November 15th seminar.
So high blood pressure has a lot of negative effects on people. Some of the ones we talked about earlier are risks for heart attack and strokes. Chronic kidney disease, obviously one of the areas I specialize in, is something that is significantly related to high blood pressure. We're going to talk a lot about this at this upcoming meeting and some of the effects. For example, most people are not aware that the treatment of blood pressure has been shown in multiple studies to decrease your risk for cardiac events such as a myocardial infarction or heart failure by up to 30% and decrease your stroke risk by up to 40%. So these are things that really do matter, and there's a good reason to treat them as well as we can.
The Heart Hospital Baylor Plano is at the forefront of innovation and treatment for hypertension. We will present much of this and everything you want to know about hypertension at the November 15th seminar. You can also go to the website at thehearthospitalbaylor.com to find the event and the treatments of hypertension that we're going to talk about. Scott?
I hope we've piqued your interest on some of the information we're going to be able to provide and the importance of managing this epidemic and the opportunities for new innovative treatments that we look forward to in the near future.